Hi, so grateful to be here, Janet. Thank you so much. My name is Dr. Sarah Michaud. I'm a clinical psychologist and I specialize in addiction, and I've also been sober a long time. I got sober in 1984.
Fabulous. And where do you live, Sarah?
I live on the East Coast of the United States. I live in central Massachusetts, about an hour outside of Boston.
I gather you grew up in an alcoholic family. I'm just reading your book now, actually, which is great. Did both of your parents struggle with alcohol, or was it just one of them?
My mom was the active alcoholic. She was an at-home housewife. My dad was a corporate attorney, and he was the classic codependent. Anybody can be codependent, and we'll get into that. But how it manifested in my upbringing was my mom was the out-of-control alcoholic, and my dad was the partner who spent his time trying to fix her, manage her, control her, basically through rage. That was his go-to.
Yeah.
And the thing with codependency is someone can try to force someone to stop drinking through anger and rage, or they can try to change someone through manipulation and people pleasing and over kindness. There's all kinds of ways codependency manifests. It just depends what your personality is. That is where I learned a lot of these characteristics, because when you grow up in alcoholism, you learn a bunch of behaviors and ways to survive and cope, right? And those behaviors end up becoming these personality traits later in life as an adult. They may not work for me, but it's how I survived in my childhood. For example, if my dad's yelling at my mother, I shut down, I get quiet, I try to get in the middle and negotiate and make things okay. That's going to be a later trait with my codependency. So, how we grow up in whatever kind of chaos or not, the behaviors we learn, how to interact with our caretakers is really what becomes our later personality.
Yeah.
And we didn't have a choice about it.
Yeah, those patterns, the neural patterns,
Yes.
laid down early, aren't they? So it's quite tough to change them, but they can be changed, can't they?
They can be changed, and I'll give you a great story later on about this YouTube video I watched on how long it takes for those neural pathways to change.
Did your father ever succeed in helping your mum come off the booze?
Well, the tragedy is this: I'm 66. My mom died at 67, and she never got sober. Everybody loved her. She was friendly to everybody, and she was really unhappily married, I think, to my dad, who probably was not a really good match. Back then, it was marrying the best provider, and they got married, and we used to joke about it that it was 42 years of unhappiness because they never seemed happy. They just were not a good match, and I'm sure my mom's alcoholism had a lot to do with that. But my dad was also a World War II vet, and I think he had really bad PTSD, undiagnosed back then. So he was just an angry person, and she was the exact opposite. And I think she drank to just cope with her pain. Also, her mother was an alcoholic, and I believe genetically, definitely predisposition. She got kicked out of a very prestigious women's college for drinking. So she drank for a long time. And the thing about codependency is my dad would get enraged with her, but he never learned about codependency where you could say, look, I love you. I really need you to stop drinking or else we're going to have to separate. He just tried to control and manage it through anger, which of course is never going to change the situation.
Um,
We know that because people, I'm sure, have gotten mad at us about our drinking. So that never helps. Never, never. So yeah, she never got sober. Go ahead.
and tried to convince me to drink less for 10 years. And every time we had an argument about it would just make me more stubborn because this is who I am. I drink to relax. Leave me alone.
That's the thing. The codependent person Their focus is on the other person changing rather than it really needs to be about us changing.
Yeah.
It's about the person saying, look, I can't do X. It's not about saying you need to stop drinking. It's saying, I'm going to do this if you don't stop drinking.
Exactly.
Yes, that's the huge disconnect.
Yeah. So you've been sober since 1984. So talk to us a little bit about your wild years before
A
you.
little bit about my journey. Okay. Wow. From the minute I picked up alcohol, I fell in love with it. At 16, I was overweight. I felt not attractive. I had grown up with 4 boys. I felt like I didn't even know what it was like to be a girl. My mother was an active alcoholic, so she and I had no relationship. And I just felt not right, like I didn't belong, like something was wrong with me, not good enough, all of that stuff. And I remember in like 10th grade, ninth or 10th grade, going to this party and drinking and just feeling, oh my gosh, this is what's going to make me happy. I feel part of, I feel like I'm making people laugh. I feel like I can belong. And that was the beginning, and I don't ever remember really drinking socially from that point on. When I drank, I got drunk. And I graduated high school, and then I started getting into drugs in a really big way because in the 80s, cocaine was huge. And the minute I did cocaine, again, I fell in love with it. The problem with that type of drug is you can stay up for days. You think you're solving the problems of the universe, literally. The conversations that go on all night long and literally are probably total nonsense. But cocaine started getting me into all kinds of legal problems. I was getting arrested. I started stealing checks from my family and forging checks. I started getting into legal problems. I went to college in Chicago and I had brought a bunch of cocaine back to college after Thanksgiving. And I ended up doing it all with my friends. And then we tried to literally rob a bank, which basically meant pulling a check scam on a bank. And we all got arrested. And my father had a photo of me holding up a number plate in front of me for years to just remind me of how far down I went. Crazy antics. I was thinking this morning for some strange reason, I ended up getting 6 tattoos, which is crazy when I think back. I haven't gotten a tattoo in sobriety, but I remember living with a man and going out, getting drunk one night, hooking up with someone, going to Providence, Rhode Island, because at the time, tattoos were not legal in Massachusetts. So we went to Providence, Rhode Island, and I ended up getting a tattoo that said, I love Scotty. And I was living with a man named Dwayne. So, I mean, that's just the insanity of my substance abuse, just trying to escape all the time. Once I got sober at 24, crashing and burning from drugs and alcohol, it's really about the underlying causes and conditions. It's about what was there before I even picked up a drink. I wanted to solve my pain, to quell my anxiety. I wanted to escape whatever was happening, but I didn't even know what it was until I was sober a while.
Yeah.
So, yeah, so I spent all that time just jackpot after jackpot, loss of job after loss of job. And of course, when people are getting sober, the problem is you think it's everything but the alcohol. You think it's the boss. You think it's the boyfriend. You think it's my financial situation. If I just get the right job or live in the right area or whatever it is. And the thing is, it's the alcohol. It's the substances. I've had patients come in and they want to solve all these problems, and I'm like, first you need to stop drinking. When you stop drinking or doing drugs, your life takes off. Recovery happens so quickly.
Talk to us about that moment when you decided that you were going to get sober.
It was more a decision that was made for me. I was up 3 nights with cocaine and Valium and pot and booze. I had just taken everything for about a 3-day period. And I remember just being on this floor. I don't even know how I got there. And my eyes opened and I felt like bugs were crawling on me. I felt like I was having a nervous breakdown. It was this moment when I just knew I had done way too many drugs too fast over a period of time, and I was losing my mind. I was at a drug dealer's house, and I went out to a phone booth, and I called one of my brothers, and I said, I need help. And I ended up in a psych hospital like within 24 hours. And I stayed there for 30 days, but then I went to a halfway house on the grounds for 90 more days. So I really stayed in that safe environment for 4 months. I couldn't imagine just living on my own and sitting with all that discomfort. I got involved in recovery programs and therapy and started doing workshops. It took off for me. I wanted to grow, I wanted to learn, I wanted to change, and I wanted to get out of pain.
So you've got expertise in codependency. Let's talk about that, please. Just define it for us. If anyone's listening to this going, what is codependency anyway?
There's probably hundreds of definitions around the internet, but basically there's a couple of things for me that really make it crystal clear. One is I'm way more focused on fixing, changing, or saving another person than I am on me. And my entire life becomes about fixing or saving or changing that other person. It's almost like an addiction to another person. And the second underlying part of that is it's really not about the other person. It's about me being able to tolerate what's happening inside of me when other people are experiencing some kind of pain, emotion, or some behavior that I don't like. So my world is about changing them so I feel better. That's what it's really about. So it's about not being able to tolerate what's happening inside of me. And the problem with that is my life and my personality becomes a series of behaviors to change my outside world. For example, rather than just tolerating my discomfort about my partner being upset, I can't tolerate it. And now I need to fix him. I need to send him to a therapist. I need to give him all these solutions. I need to control. I need to fix him rather than just noticing what I'm feeling and being a loving support. I remember sitting in an Al-Anon meeting years ago. So I got sober. And for the first 10 years, I just had all these successes. I went to graduate school. I got a PhD. I traveled. I did all of this stuff. I moved back to Boston. And what I realized was I was having tons of problems with relationships. And that's where codependency really manifests. It manifests in our relationships. Codependency doesn't work. That's the problem. We believe that, oh, if I focus on them, I'm going to fix them. And that's what I call the big lie. Like you described with your husband, the big lie is I have this power. I'm going to focus on them and I'm going to change them. And the problem with that paradigm is two things happen. One, it doesn't work. I can't change them. They have to want to change themselves. Meanwhile, my life is ruined because I lose complete connection with myself because I'm focused on another person. So that's the irony of codependency. It's this big lie that I have to operate in the world to focus on others to feel safe, and yet it doesn't work for other people and it doesn't work for me. I remember having that insight at a meeting and thinking, oh my God, we're all screwed. If you're brought up in some kind of dysfunction in a household, which probably most people are, we learn these ways of relating so young. And they become, like you say, they become our neural pathways. They become our way of thinking. Oh, I have to focus on that person. And it's really hard to change that unless you hit some kind of bottom in your recovery. And that's why I'm so dedicated and committed to talk about codependency with people, because my experiences being around sober people for so many years, the relationship stuff and the codependency stuff is the missing piece that was there way before you picked up a drink. And yet what happens is people get sober and those old patterns of relating get activated again, and then they start having lots of trouble in their relationships. So I just learned through my own experience that it's so important to really look at this. Yeah.
It makes me think a little bit about some people that want to carry on drinking and they've got lots of problems and they say, once I've solved all these problems, then
Yes.
drinking.
Denial is such a powerful cognitive state. It's crazy because it's the quintessential component of addiction, where it's one of the few illnesses that tells you don't have it. That's why it's so dangerous. And codependency is the same. I have sat with parents who literally believe if I just pay for one more treatment center, they're going to be fixed. And yet they've paid for 5 treatment centers. None of them have worked because the person doesn't want to get sober. But the parents now are sacrificing, refinancing their house, sacrificing their own lives, even though the 25-year-old doesn't even want to do it. And yet that's the killer. To survive the possibility that someone you love may not make it. That's why people are in so much denial with their codependency, because they want to feel like they can control someone, because the ultimate fear is that they might die from addiction.
I wanted to ask you, Sarah, a lot of our ladies, mostly ladies, when they're in early sobriety, it happens to me as well, it's quite a shaky, difficult time. And
Yes.
a lot of pressure from our friends and families, basically, that say things like, oh, come on, you can just have one, or you weren't really that bad. But of course, we know we are that bad. And we have to start setting boundaries, don't we? And saying, I'm not going to that wedding because it's going to be so difficult for me 8 hours
Right.
sitting around not being able to drink. Any advice? Boundary setting?
I was at a meeting recently where probably 80% of the room were women over 30 years sobriety, and they were still struggling with speaking up, setting boundaries, people-pleasing behavior. And to me, if you can start this way early on, I think you'll be so far ahead of the game. And this is the thing about codependency, and I believe with addiction as well, is fear is really at the bottom of it. Our fear of what? Fear of someone else's opinion, fear of someone else getting mad at us, fear of their rejection, fear that they'll abandon us, fear that I'm going to feel uncomfortable, fear that I might feel upset, fear that if I speak up and say my truth, this person may not like me anymore. They might not love me anymore. So the core of codependent behavior is fear. So I always suggest to people when they're starting to set boundaries, number one is know this. When you start setting boundaries, you're going to feel guilty because you've never done it before. So just because you feel guilty, it does not mean to change and go back to your old ways. What it means is you're creating a new pattern.
Yeah.
And it's new, and it's not going to feel quite right at first. What I suggest to people is do it in less charged situations. So, for example, say you go to Starbucks and the person gives you the wrong coffee. See if you can ask for a different coffee. Do you know what I mean? Like, I know people, and I give the example in the book of buying a pair of shoes because I felt sorry for the salesperson. Start with less charged relationships, people you may not even know. If a service person gives you the wrong coffee, say, hey, I meant to get a latte. I'm sorry. Start in these less charged situations and practice with people that you know better. So, for example, if people are in your tribe and they know other people in the group, someone asks them out to lunch, they don't want to go, they don't have time, practice with that person. Say, gosh, this is really hard for me to say, but I'm trying to practice a boundary. I can't go to lunch on Thursday. It sounds so simple, but it's not simple at all. And it's not easy for people. And the thing is, the fear, and this is some of the work I do with people, is from way back when, the fear isn't even about the present moment with the person at Starbucks. The fear is so much greater. This person at Starbucks doesn't care, right? But sometimes the activation in our systems feels very intense.
Yeah.
So again, it's just acknowledging your feelings, taking baby steps, doing it in smaller environments with people that you feel safer with, and practice. It requires practice. When you take a risk in relationships that are true friendships, you realize they didn't abandon you. They didn't reject you. They didn't get upset. And then you carry that around. Oh, so I can speak up for myself and set a boundary, and someone isn't going to abandon me.
One of our members, she was doing our 3-month course. And so there was like an hour of study to do every evening. She was a busy working mom with 3 kids. She said to them, I've signed up for this program that I really want to do. And every evening I'll be going into the bedroom, closing the door, be on my laptop for an hour, and I don't want to be disturbed. And to start with, they said, oh, that's a bit strange. Why? And they interrupted her for the first few nights, but then they realized she was serious and they respected her, and it worked. And she got through the program. And I think that was a clever thing to do rather than just trying to sneak in the work when nobody was looking as if it's a shameful secret or something.
It's a win for her and it's a win for the kids. We could do a whole other one on parenting.
Cool.
Because the thing with alcoholic parents or people that get sober is they have so much guilt and shame that they overcompensate when they're parents. This has happened for years in my practice. And so they don't set boundaries out of guilt, and it creates all kinds of problems because kids need boundaries. So that's a win for both people. And also, when you set boundaries with kids, they're going to immediately challenge it. So it's really great that she set the limit, and it might have taken a few days, but she stuck with
Yeah.
because if you don't, then it gives the total wrong message.
Of course. Yeah.
Yes.
So
Yeah.
we're very proud of her and her boundaries.
Oh, that is so great. Great example too.
So let's talk about your book. I love the title, Co-Crazy, One Psychologist's Recovery from Addiction and Codependency. I wanted to ask you, first of all, what inspired you to write this book, and what is the core message?
Why I ended up writing the book is this. When I was about 20 years sober, I was married to a guy that had about 15 years of sobriety, and he relapsed. He had some surgeries. We've heard this story a billion times, right? He had surgeries. He started taking opiates. It was complicated. It took me a while to figure it out. And what I realized during that time in the early 2000s was this. I have a PhD in psychology. I'd been working with addicts for 25 years. I'd been in Al-Anon for 20 years. I'd been sober for 20 years. And yet I was struggling with my codependency. And I thought, if I'm struggling and I've been sober. I have the education, I have the experience in Al Anon. Then this is not an easy thing to navigate. So I really felt that I had a message because I went through it myself. And I have a lot of experience, not only with myself, but with seeing people for so many years and knowing people over the years in sobriety. And I felt like I could really cull down the important pieces. The biggest message is this, and I say, I think in the introduction, this isn't something that necessarily people are going to like, is that I'm responsible,
Yeah.
that I can't change someone else. I can't fix someone else. And I'm not just talking about addiction. The group that I used to do online was called Coming Home to Ourselves. And it's because when we're so focused externally on pleasing everybody else or controlling everyone else, one or the other, we're not focused on us and we get real detached from who we are.
Yeah.
And I'm sure people like this that are caretakers and focus on their kids way too much or work 70 hours a week or whatever. And the next thing you know, they're exhausted, they're burnt out, they're drinking more, they're angry and resentful because they've been doing all this stuff that they really don't want to do. So the first tool of codependency recovery is self-care. It's starting to say to yourself and doing an assessment with your life. What am I doing that I really want to be doing? And what are the things that I'm doing just out of the fear of upsetting someone? And if you're a woman on the planet, let's face it, we are trained to be codependent from early on.
And trained to people please.
Ye- Absolutely.
Have you ever
Absolutely.
Glennon Doyle's book, Tamed?
Yeah.
That book.
Yes. I have the sweatshirt. And in fact, what's so funny that you're saying that? When I first did these online groups during COVID, we all bought the sweatshirt Untamed because it really was about my own voice, learning how to speak up for myself. One of the tools is to ask yourself, what do I want? What do I need? What do I want? What do I need? Because codependent people are always focused on what everybody else wants and needs, and they go last. And so I've even had clients say, I don't even know what my needs are. We become so detached from ourselves that we don't even know what a need is. So really important to just start getting back in your own body and getting in touch with yourself.
Your podcast, what's it called?
Okay, so the podcast is called Leaving Crazy Town. And what happened is I met two women and they asked me if I would do a group on codependency. So we ended up doing a group and a bunch of people that were struggling with codependent behaviors. And then I got really close to one of them. He ended up transitioning. He's a man now, and his name is Fen. He's one of my best friends. And he and I decided to do a podcast. When you're in sobriety and when you're in recovery from codependency, tons of people have trauma. They start digging up stuff. It's not just it's necessarily easy all the time. And he and I have really the same sense of humor. And we thought, look, we're going to do this podcast where we can talk about heavy topics, trust, sex, relationships, speaking up, boundaries, etc., and also tell stories of how we screw up in our own lives. We have a lot of fun with it. And also, I think people enjoy it because we have a certain lightness about it. So people can learn something and have some laughs. So that's why we started it. And it's on YouTube at Leaving Crazy Town. And definitely check it out. We talk about anything around addiction and codependency recovery. And my website, drsarahmichaud.com.
And they can contact you via your website.
My website, and there's an email on there. And yeah, anybody can email me. Absolutely. Be happy to be helpful.
So a last question, Sarah. If someone's listening to this and they're deep in trouble with drink and drugs, and they just don't know where to start. They know they want to get sober, but it feels too hard what you
Right.
say to them.
Yeah, this is the thing I would say. It's so hard, I think, sometimes for us. You're not even supposed to use the word alcoholic anymore, but it's so hard to admit that we have a problem. I was so self-reliant. I never wanted to ask for help. And that's the thing with us is like we have these wonderful parts of us, and yet substance abuse and alcoholism happens to the best of us. If you are struggling or your mind is starting to wonder if you have a problem, the thing is this. Once you're already thinking that, the likelihood is probably 99% that you have a problem. And the first step is always finding someone. You go to Janet on the Tribe Sober. There are so many avenues now and support. When I got sober, there was like one way to do it. And now there's so many books, there's so many ways to do it. But the thing is, the first step is to put down the substance. And I will promise you that you will get better. Sometimes your life circumstances don't change all that much for a little while, but you will get better. So it's getting out of ourselves and letting go of our egos for a minute to ask someone for help, whether it's online, whether it's a therapist, whether it's a group, whether it's someone in your town who's sober. It's just reaching out for help, just taking that one step, and your entire life can change.